Good morning students. Last class we had discussed regarding the thyroid gland actions. This class we will be discussing regarding the applied aspects of the thyroid gland. So by the end of the session you should be able to define what is goiter, what are the goitrogenous substances that are involved, what do you mean by myxedema, what is cretinism and what is Graves' disease. So let us begin with the first topic for today, that is goiter. So any abnormal increase in the size of the thyroid gland is called as goiter. As you can see this in this picture, this is a picture of a lady with an enlarged thyroid gland. So the swelling in the neck or neck swelling is called as goiter. There can be a lot of reason or causes for goiter. It can include a euthyroid state, that is, even if the thyroid levels are normal, the person can have goiter. If the thyroid hormone levels are decreased, as is seen in hypothyroidism, can have goiter, or if the thyroid hormone levels are increased also you can have goiter, as you see in hyperthyroidism. So there are certain substances called as goitrogens, okay, that which usually decrease the thyroid hormone synthesis. So whenever the thyroid hormone synthesis is decreased, there is a feedback increase in TSH, which stands for thyroid stimulating hormone. So whenever this occurs, there is stimulation of the thyroid hormones, which in turn results in the enlargement of the thyroid gland, resulting in goiter. So another thing to note is that a goiter does not denote the functional state of the thyroid gland. That means if a patient has an enlarged thyroid gland, so do not jump into the conclusion that the patient has an abnormal thyroid dysfunction. You should always confirm with the clinical examination and blood investigations. Coming on to goitrogenous substances, that is the foods that are good for the thyroid gland, foods that are bad for the thyroid gland. So as you can see in this picture, the nuts, the fresh vegetables, lean meat, the seafood, kidney beans, coconut, etc., all these are beneficial for your thyroid gland, whereas cruciferous vegetables such as your cabbage, excess of soy, excess of caffeine, excess of junk food, alcohol, etc., all this predisposed to goiter, or in other words, all this are goitrogenous substances and all this are bad for your thyroid gland. So you can see this, the thumbs up symbol here, which denotes good for the thyroid, and thumbs down for poor thyroid, the substances which cause or substances that are bad for the thyroid gland. So next we will discuss regarding hypothyroidism. So as the name suggests, hypo means decrease. So hypothyroidism means decrease in the levels of the thyroid hormones, or low circulating levels of the thyroid hormones, that is free T3 and T4. So there are multiple causes of hypothyroidism. You can classify it under three headings. One is primary hypothyroidism, or the primary cause for decrease in thyroid gland. That includes any disease of the thyroid gland itself. Okay, if the thyroid gland itself is damaged, it can result in primary hypothyroidism. Then the secondary causes are little bit above the level. That is, the secondary cause of hypothyroidism includes any disorder of the anterior pituitary. So as you are aware, it is the anterior pituitary gland which secretes your thyroid stimulating hormone, which in turn will activate the thyroid gland to produce your T4 and T3. Those are your thyroid hormones. Then the secondary hypothyroidism can also be caused due to any disorders in the hypothalamus. So it all begins from the hypothalamus. So hypothalamus will secrete your TRH, which in turn will stimulate your anterior pituitary to release TSH. This TSH would again act on the thyroid gland to produce your T4 and T3. So any damage in the hypothalamus also can result in secondary hypothyroidism. There is another entity called as tertiary hypothyroidism, and it is mostly commonly caused due to the presence of any tumors. Okay, coming on to the further subdivision of hypothyroidism. Suppose a child presents with hypothyroidism, so you can call it as a condition called as cretinism. And suppose an adult presents with hypothyroidism, this condition is called as myxedema. So cretinism is seen in children, and these children are also called as cretins. Okay, cretins. And adults, this is called as mixed edema. So what are the investigations which we usually do for diagnosing a patient with hypothyroidism? So the investigations include your TSH, that is thyroid stimulating hormone, and your thyroid hormones, that is T4 and T3 levels. So usually in hypothyroidism, there is decrease in the T4 as well as T3 levels, whereas there is an increase in the thyroid stimulating hormone. So this is evident by the hypothalamus pituitary thyroid axis. If you take that, as you are aware, we have discussed in the initial classes regarding the negative feedback mechanism. So whenever there is a decrease in a certain hormone level, and there is a negative feedback sent to the primary organ and then the secondary organ. That is, in this case, suppose there is decrease in the T3 or T4 level, the anterior pituitary is stimulated first, followed by the stimulation of the hypothalamus. So this is what we call as auto-regulation. So whenever there is a decrease in T3 and T4, the TSH level or the thyroid stimulating hormone is stimulated to produce or counterbalance the decrease in the thyroid hormone level. So that is what we see in hypothyroidism. And this slide itself, you can see the symptoms that are seen in hypothyroidism. So you are well aware regarding the actions of the thyroid gland. So even though the thyroid gland is not essential for life, but it has various role to play in various organs. So based on that physiological features or physiological actions, you can come to a diagnosis based on the deviation from the physiological features or physiological actions. That is, say, on the hair. As you are aware, thyroid hormone is responsible for the hair texture, that is for keratinization, it plays a role. Due to decrease in the thyroid hormone levels, the person can have dry hair. Similarly, the person can have loss of eyebrow hair. Next, coming on to the face. Due to decrease in the thyroid hormone, you can have swelling of the face due to accumulation of what we call as mucopolysaccharides. Then enlargement of the thyroid, just we discussed the cause for enlargement of the thyroid gland or the neck in individuals with hypothyroidism. Then individuals with thyroid levels, decrease in thyroid levels, they can have slow heartbeat. It is also called as bradycardia. So this slow heartbeat is seen in individuals with hypothyroidism. As you are aware that the thyroid hormones are responsible for myocardial contractility or contraction of the heart, and maintain the rhythm also. These thyroid hormones have a physiological role. Then next you can see there is cold intolerance. So the individual with hypothyroidism will not be able to tolerate cold temperatures when compared to a normal individual who would be able to tolerate cold temperatures. Then patients with hypothyroidism, that is decrease in thyroid hormone levels, are predisposed to depression. Okay, so such patients, we are supposed to rule out what we call as the organic cause or any cause that is the actual cause for depression, then only go for giving antidepressive medication. So in these kind of patients, if you correct the thyroid hormone levels, the depression also can be corrected. Then it has a role to play in the skin manifested as dry skin. So people with hypothyroidism will have dryness of skin. They are easily fatigable. That is, the patients with hypothyroidism will be tired easily. Okay, they will be easily tired, and they will have this forgetfulness. So thyroid levels, as you are aware, we learned in the previous class that it is responsible for the CNS alertness in the central nervous system. So when these hormone levels are decreased, this individuals will have forgetfulness. Okay. Next, the menstrual disorders. So there are menstrual irregularities in patients with hypothyroidism, and it is usually polymenorrhea. People with hypothyroidism are predisposed to what we call as infertility. So they, in the long run, if hypothyroidism goes untreated, they are predisposed to this condition called as infertility. Infertility means they will not be able to have children. Next, muscle aches. So there is muscle pain or muscle ache in individuals with hypothyroidism. due to weakening of the muscles. Because the protein metabolism is affected. As you are aware, this comes under special metabolism. We discussed last time in the actions of thyroid gland. So, the protein metabolism affected, thereby there is muscle ache. Next, the individuals with hypothyroidism will have weight gain. Okay. So, weight gain, even though they are eating less, they will have weight gain because the basal metabolic rate is affected. Similarly, these individuals can have constipation also. Again, the GIT is affected and there is slow bowel movements which will result in constipation. They can also have brittle nails. So, these are some of the clinical features in subjects or patients with hypothyroidism. So, based on getting a good history from the patient, so you have to get a good history from the patient and you have to look for these signs. So, there are some signs, you can ask the symptoms from the patient and you can look for certain signs which will lead you into the diagnosis of hypothyroidism. So, make sure you check all these before you make a diagnosis of hypothyroidism. So, the previous slide we discussed regarding the general features seen in hypothyroidism. So, that is generally what is seen in a patient with hypothyroidism. Now, we will go on to the types of hypothyroidism. So, there are mainly two types, cretinism as well as myxedema. So, we will discuss cretinism now. Cretinism is the hypothyroidism in children and these children are called as cretins. So, what is the cause for cretinism? So, as you are aware, this can be caused due to the following. One is maternal iodine deficiency, that is, if the mother of the child is deficient in iodine, the child born can be predisposed to cretinism. Second, whenever there is maternal hypothyroidism, so when the mother has hypothyroid or she is a known hypothyroid and she is not on regular medications, the child can have cretinism. Next, due to congenital absence of thyroid gland also the children can have cretinism, because as soon as the child is born there is no thyroid gland as such to for the production of the thyroid hormones and for certain functions of the body. So, absence of the thyroid gland also will result in cretinism. Another factor that can cause cretinism is the mutations, especially it can be seen as a genetic mutation at the TSH or thyroid stimulating hormone receptor. So, this receptor is mutated and so once mutation occurs, this receptor is not able to stimulate your thyroid gland to produce your thyroid hormones. So, this also can result in cretinism. So, what are the clinical features? So, clinical features of cretinism include, one is the appearance of the child. So, as soon as the child is born, initially we will not be able to diagnose the condition. It will take up to 1 to 3 weeks for the symptoms to appear. So, the clinical features or the appearance include a unpleasant or an idiotic face, that is the child will the textbooks say it as the child appears as an ugly and an idiotic child with broad nose. So, the nose is broad, as you can see in this picture, the nose is broad in this child with large protruded tooth. Okay. So, the large protruded tongue. So, the tongue is protruded and it is large enough. This is one of the classical findings seen in cretinism. Then the child can have pot belly also. So, these are some of the classical features or facial features you see in a child with cretinism. Then the next thing is regarding the growth of the child. The skeletal growth or the muscle growth of the child is affected more than the soft tissues in the child. When you compare this child with a normal child, as this child grows, there can be discrepancies in the height and the height of this child compared to a normal child. So, the upper part of the body is taller, that is the trunk is taller compared to the limbs. Okay, that is the upper limbs and lower limbs are usually shorter when you compare it with a normal child. When you come on to the skin, usually the skin is dry, coarse and wrinkled, just like the similar features seen in adults on hypothyroidism. There is delayed development of milestones. So, milestones are something which we usually watch out for child, as the child is born, as the child grows, the child is supposed to attain certain milestones, or the child is supposed to perform certain tasks. If the child does not perform certain tasks in that said framework of time, we say that the child has delayed milestones, or there is some delay in development of this milestones. So, these children are predisposed to delayed milestones. So, they are little bit slower compared to, or slow in developing or achieving the milestones compared to the normal children. And as they grow older, they have poor sexual development. So, if you look at their external genitalia, it will be smaller compared to a normal child. So, as these children, they hit puberty also, they are unable to reproduce. That is, in the future they cannot parent any children due to a condition called as infertility, which will affect these children due to the absence of this thyroid hormone and or the decrease in the thyroid hormone. And another classical feature which you should never forget is regarding the mental retardation. So, as you are aware, if a person is mentally retarded, we cannot do much. Okay, we cannot do much, we can just give them occupational therapy, behavior therapy, etc., but we cannot do much in such cases of mental retardation. But this particular condition called as cretinism, okay, it is the only condition in which this mental retardation can be reversed. Okay, if you find and treat this as early as possible. So, due to this disproportionate growth of the body, they are also called as dwarf. Okay, so they are predisposed to a condition called as dwarfism due to decrease in the thyroid hormone levels, and you should be able to differentiate between hypothyroid dwarf and pituitary dwarf. Okay, as you remember, you have learned in under the lecture on growth hormone regarding the pituitary gland and the dwarfism that is caused due to pituitary gland. So, make sure you know the difference between the pituitary dwarf as well as the hypothyroid dwarf. Next, a classical feature which you should never forget is regarding the mental retardation. Okay, mental retardation is usually individuals with mental retardation, we cannot do much about it other than giving them occupational therapy, behavioral therapy, etc. But in cretinism, it is the only condition in which the mental retardation can be reversed if found out and treated as soon as possible. So, even though the physical appearance can be altered, even if the treatment is delayed, or the physical appearance can be corrected up to a limit if the treatment is delayed, but the mental retardation has to be treated as soon as possible when you detect or diagnose this condition, because it is the only type of mental retardation that can be reversed completely. Okay, it can be reversed completely. So, make sure that you are very stringent in identifying and diagnosing such children and start the treatment immediately. So, the treatment, as you are aware, since it is the deficiency of thyroid hormone or decrease in thyroid hormone deficiency, we will give them thyroid hormone supplements or thyroid hormone drugs, we will give them, and it is a lifelong treatment. So, you can replace them replace the thyroid hormone levels by giving them drugs. Also, you can prevent this. How can you prevent how can you prevent hypothyroidism? It is by early screening. So, usually as soon as the child is born, we do what we call as neonatal TSH screening. Okay, so neonatal TSH screening is done as a routine in hospitals, and based on the level we can say whether the child has hypothyroidism or not. So, as you are aware, what would be the result of the TSH level as soon as it comes in a child with hypothyroidism? Yes, it is. Yes, it is. The TSH levels would be increased. Okay, the TSH levels would be increased. So, suppose in a newborn there is a slight increase in the TSH level. We wait for 3 more weeks, up to 3 to 6 weeks, and we repeat a neonatal TSH level, and if it is still higher, we start the treatment for hypothyroidism. So, this was the condition seen in children called cretinism. Now, moving on to adults. So in adults, when you see hypothyroidism, it is called as mixed edema. Okay, mixed edema is seen in adults, and the cause is again the same, almost the same. That is, if the subject or the patient has severe iodine deficiency. So either it can be due to decrease in intake of iodine from the glands, from the food. Next is autoimmune disease. Okay, autoimmune means the body itself attacks the cells of the body. It can be seen in the condition called as Hashimoto's thyroiditis. Itis means inflammation. Thyroiditis means inflammation of the thyroid gland. So Hashimoto's was a Japanese physician who diagnosed or discovered this condition called as Hashimoto's thyroiditis. And the next cause for mixed edema include your the secondary causes, that is the pituitary as well as hypothalamic disorders. So hypothyroidism in adults is called as mixed edema. You can see in this picture a lady in her 50s has puffiness of the face. Puffiness of the face, there is swelling, and you can say that she is obese also. There is dry skin, there is dry lips, okay, there is dryness of the hair, etc. So from looking at the clinical feature of the subject itself, you will be able to identify whether the patient has hypothyroidism or not. Coming on to the clinical features. Clinical features of mixed edema or seen in mixed edema. So this is almost similar to the general features. So I will just point out the main signs and symptoms. So one thing is facial puffiness. So the patient hypothyroidism will have a swollen face or a puffed up face with edematous hands and feet. So the hands as well as the feet of these subjects would be swollen. And again, swelling, as you are aware, is due to accumulation of your mucopolysaccharides. Example include your chondroitin sulfate. Next, these patients will have complained that even if they eat even a less quantity of food, they keep on gaining weight. Okay, even if they eat less quantity of food, they keep on gaining weight. So weight gain despite poor appetite is also a classical finding or a classical history you can get from this patient. Next, they are intolerant to cold. So they have cold intolerance. There is hoarseness of voice. Okay, hoarseness of voice. Another peculiarity of this condition is that this is one of the diseases that can be diagnosed over phone. You call a person and you talk to that person, and when you listen to the sound of the person through the phone itself, you will be able to tell whether the patient has hypothyroid or not. So they have a typical or classical hoarseness of voice. Next, they have mental as well as physical lethargy. So they are very slow in understanding things, they are very slow in doing their work, and they are very tired or lazy in performing their day-to-day activities, and they have increased sleep. So how much ever these individuals sleep, okay, they will not get enough of the sleep, still they will be tired or still they will be sleepy. Next, they have slow reflexes. So or the reflex time or reaction time we say is very slow. So for example, if a person touches a glass of hot water, he immediately reflects back or he immediately takes his hand back. But in this kind of individuals, there is a slowness is in taking back the hand. So that is again caused due to hypothyroidism, and there is delayed relaxation time as well. Next, these individuals will have decreased in body basal metabolic rate, decreased in basal metabolic rate. So the metabolism in these individuals are affected. So whenever there is decrease in metabolic rate, they have again cold intolerance, they will have constipation because of decrease in metabolism. Then the next are some of the systemic features in the cardiovascular system. You can see bradycardia, that is slow heartbeat, which we discussed previously. The patient is predisposed to hypertension as well as atherosclerosis. So hypertension is a condition that results in increase in your blood pressure. Next, atherosclerosis. Atherosclerosis, as you know, it is caused due to increased deposition of cholesterol within the blood vessels. So there is increased cholesterol deposits within the blood vessels, again that can predispose the individuals with to hypothyroidism. and they have we call it as dyslipidemia, that is impaired lipid profile due to increased cholesterol deposits. Next, the skin is usually dry, thick, and there is also a yellowish tinge to the skin. If you remember last class, we learned regarding beta carotene. So, it is a pigment that is produced in the skin with the help of your thyroid gland. So, whenever there is deficiency in hypothyroidism, this will prevent the breakdown of beta carotene, and there is accumulation of beta carotene within the skin. Okay, and another thing which you should keep in mind is that you should be able to distinguish between jaundice as well as hypothyroidism. Okay, so in jaundice the classical feature is yellowish discoloration of the sclera. Okay, it has the bilirubin or the bile pigments have a predisposition to the sclera or the elastic fibers in the sclera. So, in jaundice the individuals will have yellow eyes also, along with the yellow eyes they can have yellowish mucosa as well as skin. Whereas here you can have typical yellowish or orangish tinge to the skin in adults. So, this also is a clinical indicator that the subject or the patient can have hypothyroidism. So, there is loss of hair in these individuals, there is menstrual abnormalities like menorrhagia, there is they are predisposed to infertility again, they can have constipation due to decreased metabolic rate, and they can also have anemia. Okay, anemia is a condition diagnosed by decrease in RBC count or hemoglobin or both for that particular age and ethnicity. Then the last condition is called as mixed edema coma. Okay, so this is a serious condition. So this happens whenever there is what we call as Hashimoto's thyroiditis, which we have discussed previously, inflammation of the thyroid gland. So whenever there is inflammation of the thyroid gland, the symptoms can flare up, okay, and result in a condition called as mixed edema coma. Mixed edema coma. So in general, coma is a condition in which the patient cannot be aroused from their sleep. So those were the features of mixed edema. Next, we go on to the next applied aspect. So previously we discussed regarding goiter, we discussed regarding hypothyroidism, we discussed regarding the types of hypothyroidism. So hypothyroidism seen in children is called, yes, cretinism. Hypothyroidism in adults, mixed edema. Yes, so now we will go on to hyperthyroidism, that is increase in the level of thyroid hormones. So increased circulating level of thyroid hormones is called as hyperthyroidism, that is there is increase in free T3 as well as T4 levels. So there are many causes of hyperthyroidism, but this class will be discussing or focusing mainly on the first cause, that is Graves' disease. So Graves' disease, you have toxic adenoma and toxic multinodular goiter, as the name suggests, you have multiple nodules present on the neck region. Then you have TSH secreting, that is thyroid stimulating hormone secreting pituitary tumor. So due to the presence of a tumor in the pituitary gland, there is excessive secretion. So this tumor will excessively stimulate your pituitary gland to produce excessive thyroid stimulating hormone. So what are the blood investigations which we usually do for hyperthyroidism? It's the same which we do for hypothyroidism, okay, or any thyroid abnormality, that is T3 you check, T4 you check as well as TSH. So here the difference is hyperthyroidism. Okay, so there is elevated thyroid hormone levels. So whenever there is an elevation in thyroid hormone levels, again the negative feedback mechanism would be activated. So whenever there is an activation of negative feedback mechanism, this will go and initially it will stimulate the pituitary gland, then it will go and stimulate the hypothalamus. So whenever there is stimulation of the pituitary gland, this will result in decrease in thyroid stimulating hormone levels. So in hyperthyroidism, you have you have elevated T4, T3 levels, and you have decrease in your TSH levels. Now next is regarding the symptoms in hyperthyroidism. It's almost, or you can say it's just the opposite of the symptoms seen in hypothyroidism. So you can have excessive sweating due to excessive basal metabolic rate, increase in basal metabolic rate. There is again enlargement of thyroid hormones, there is thyroid gland, there is rapid heartbeat. Rapid heartbeat is called as tachycardia, that is anything more than 100 beats per minute is called as tachycardia. The people are nervous, okay, there is excessive nervousness, at rest. So all these symptoms are usually seen in individuals who are at rest. Okay, so not when a stimulus is given, because we all tend to get nervous, okay, due to different situations, but here at rest they will have nervousness. Next, they are unable to tolerate heat. Okay, they are unable to tolerate heat compared to the normal individuals. So they always feel hot. They always feel hot due to heat intolerance, due to excessive activity of the basal metabolic rate, excessive thyroid hormone levels. Next, they are easily irritable. Okay, they are irritable. They are restless. They are irritable. They cannot focus on a thing. They have difficulty in sleeping. They cannot get a good night's sleep. So they suffer from a condition called as insomnia. Okay, insomnia, not able to sleep well. They will have trembling of the fingers, so tremors seen in the fingers. They will have warmness or moist palms. So their palms are moist due to excessive sweating. They can have menstrual abnormalities, especially what we call as oligomenorrhea. Oligomenorrhea means scanty menses. They are predisposed to infertility. They have muscle weakness. Again, excessive production of thyroid hormone can result in excessive protein catabolism. Even though thyroid, as you are aware, thyroid hormone is a hormone that is required for anabolic action or build-up of the muscles, excessive thyroid hormone can result in protein catabolism, which results in breakdown of proteins, which will further result in muscle weakness. Next, weight loss. How much ever these individuals will have a they have a larger appetite, or they keep on eating, but they are unable to gain weight. So they have weight loss, and they have frequent bowel movements. Again, due to increased metabolism, they will have frequent bowel movements. They have to use the washroom here and then. Then they have soft nails. The nails of these individuals are soft. So whenever you ask the history, try to look for certain pointers in the history so that you will come to a diagnosis of hyperthyroidism. So next is the Graves' disease. So even though there are a lot of causes, here we will be focusing mainly on a topic called as Graves' disease. That is one of the most common cause for hyperthyroidism, and it is classical. So in Graves' disease, it is also called as exophthalmic goiter. Exophthalmic goiter. Ophthalmo or ophthal means eye, related to the eyes. Exo means there is excessive size, or there is protrusion of the eyes. It is called as exophthalmic goiter. Graves' disease is also called as exophthalmic goiter. It is caused due to diffuse enlargement of the thyroid gland with a normal TSH level. Okay, with the normal TSH level, even though the TSH levels are normal, the thyroid gland is enlarged. Thyroid gland is enlarged. It is usually an autoimmune disease. Okay, it is an autoimmune disease, and the reason for autoimmune disease is usually idiopathic. So when we say autoimmune disease, it simply means that there are antibodies or cells produced attacking the thyroid's own cells. So antibodies are produced against the thyroid cells, and you have classical antibodies. It is called as long-acting thyroid stimulator LATs or thyroid stimulating immunoglobulins. Okay, so long-acting thyroid stimulator or LATs or thyroid stimulating immunoglobulins, they are IgG type of immunoglobulins. Okay, IgG type of immunoglobulins that have a structure similar to TSH. So what happens is that they will go and bind to the TSH receptor and prevent it from activating the thyroid gland and for normal production of the thyroid hormones. So there is activation of your LATs, so long acting thyroid stimulator. So because of this, as the name suggests, long acting thyroid stimulator keeps on stimulating the thyroid gland to produce excessive thyroid hormones. That will result in hyperthyroidism. Here it is the Graves' disease. So they attach, like I said, attach to TSH receptors and secrete large quantities of thyroid hormones or thyroxine. So what is the reason or cause behind this enlarged eyes or exophthalmos? It is also called as proptosis, that is, the eyes is coming out. It looks like the eyes are bulging out. The reason behind this is accumulation of fluid and cells in the retrobulbar tissues. So the bulb in the eye, retrobulbar means behind the bulbar region. So whenever there is accumulation of fluid and cells in the retrobulbar tissue, this will result in what we call as edematous swelling. Okay. So it is this edema or the swelling or this fluid collection which will push the eyeballs forward, and due to this, since the eyeballs are pushed forward, the person is unable to close his eyes completely. Okay. So you ask a person with hyperthyroidism, especially Graves' disease, to close his eyes, you can see that he is unable to close his eyes completely. Still you can see the white of the eyes. So due to this incomplete closure of the eyelids, it can predispose the person's cornea to dryness as well as ulceration. Okay. So what is the complication of this corneal dryness and ulceration? It will result in blindness. Yes, it will result in blindness. So whenever you are treating a patient with hyperthyroidism, you treat them based on their symptoms. Okay. Other than just giving them the drugs, you also look for the symptoms and try to treat accordingly. So here the patient should be given good eye care. Okay. Eye care to prevent them from blindness. So this is the the pathophysiology behind the exophthalmos or swelling of the eyeballs. So again, the clinical features are almost same as in hyperthyroidism. So this is a classical feature. You can see that the patient, or in this picture you can see that this individual is staring at you. Okay. So this is unintentional. This is due to exophthalmos. They have this starry eyes or staring feature, staring at you. So again, the features are same as seen in hyperthyroidism, which includes intolerance to heat. You have increased basal metabolic rate, increased appetite. Even though they have this, they still have weight loss. Their skin is warm and moist. They can have serious cardiovascular changes. Include they have palpitation. They keep on have palpitations. They have tachycardia. Tachycardia is the heart rate more than 100 beats per minute. They have widening of pulse pressure. So pulse pressure, as you are aware, is the difference between systolic blood pressure as well as diastolic blood pressure. So they have widening of the pulse pressure. They have fine tremors of hands, and their reflexes are brisk. Okay. So you can take the example of when you compare it with hypothyroidism, they have a quick reflex. They have weight loss, and they have thyrotoxic myopathy. Myo means muscle. Okay, myopathy. So whenever there is excessive thyroid hormone, there is excessive destruction of the muscles, which results in thyrotoxic myopathy. They can have diarrhea, like I said, frequent bowel movements they can have due to excessive stimulation of the thyroid hormone. They can have oligomenorrhea or scanty menses as a part of Graves' disease or hypothyroidism. They can also have absence of menses, that is called as amenorrhea. Amenorrhea means there is absence of menses. Okay, so how do you treat? So there are various treatment options for hyperthyroidism. One is you can give them a medical treatment. That is, medical treatment is by the use of anti-thyroid drugs. Anti-thyroid drugs, and you can also use beta blockers. You can use beta blockers like propranolol. Okay, it is a beta blocker which helps in controlling the blood pressure. Also, it helps in controlling the tremors. So you can treat according to, like I said, the signs and symptoms. You can treat the individual, and you can give them medical treatment. Another option is radioactive iodine ablation. Okay, radioactive iodine ablation. So it is an ablation with the help of radioactive iodine. So you can ablate the thyroid gland as such. Next is the surgical option. Okay, surgical option include thyroidectomy. As you are aware, thyroidectomy means removal of the thyroid gland. So patient with hyperthyroidism, severe symptoms with hyperthyroidism, patient with Graves' disease, you can opt for surgery. So post surgery, you have to give them thyroid tablets, okay, to supplement the loss for thyroid tablets. So what happens is, whenever a thyroid gland is removed, okay, due to hyperthyroidism, you remove the thyroid gland immediately, the body is in short of thyroid hormones. So to prevent the loss or the sudden loss of thyroid hormone, because the sudden loss can result again in hypothyroidism. So to prevent that, after surgery you always give them lifelong thyroid tablets or thyroid medication, that is thyroxine. Okay, so these were the different applied aspects in your thyroid. So let us summarize. So what you have learned in the few slides. So initially we began with what is goiter. Okay, so goiter is, there are a lot of causes for goiter. Goiter can be seen in an individual with euthyroid state. Euthyroid state means normal thyroid levels. Then it can be seen in individuals with hypothyroidism, and it can be seen in individuals with hyperthyroidism. Okay, so euthyroid state, hypo as well as hyperthyroidism, you can see goiter. And by diagnosing a patient with goiter, you cannot exactly say the functional status of the thyroid gland. So we discussed regarding the goitrogenous substances, that is, there are certain food items that can cause your hypersecretion of the thyroid gland. So we saw the food that are good for the thyroid, and we saw the food items or substances that are bad for the thyroid gland. So an example of one goitrogen is cabbage. Okay, so in people who have excessive amount of cabbage, excessive amount of, another example is junk food. So all these individuals are predisposed to a thyroid abnormality or goiter. Next, we saw what is hypothyroidism, the clinical features in hypothyroidism, and the different types of hypothyroidism. So the hypothyroidism seen in children is called as cretinism. So under cretinism, we discussed regarding the importance of identifying it as early as possible, so that we can prevent or we can reverse the mental retardation that is seen in cretinism. And we discussed regarding mixed edema, that is hypothyroidism in adults. So importance of identifying the hypothyroidism based on the clinical symptoms, okay, signs and symptoms in that individual. Next, we discussed a part of hyperthyroidism, what is hyperthyroidism, the clinical features in hyperthyroidism, and what is Graves' disease. So this is also called as exophthalmic goiter, that is, there is protruding eye bowels in these individuals. So it's a classical finding and a classical diagnosis, and we saw the reason behind it. It is mostly autoimmune due to activation of what you call as LATs, long acting thyroid substances. Yes, so any doubts? Okay. So if no doubts, then we will, next class we will be discussing on a new topic, that is called as parathyroid. Parathyroid and calcitonin, we will discuss it in the next class. Thank you.